Hey, good morning, everyone. Welcome to Joy Academy's webinar. I would like to thank you all for your time this morning. And India thi આવતા હોય અને evening માટે. Good evening, Jai Shri Krishna badane. આજે one of my favorite and personally involving topic છે. So I'm very excited to share this webinar. I have been waiting for this webinar for a very long time. It's going to be super informative, and I know that every one of us will go home with a lot of information today. So stay tuned throughout. At the end, we will open up the panel so that you can ask questions and answers. છેલ્લે આપણે બધાને question answer પૂછવાનો chance મળશે. આજનો આપણો webinar is on conceiving and infertility. So it's about, the most beautiful feeling of becoming a mother. It is obviously a chance of luck. It's also about you being lucky. સૌભાગ્યની વાત છે કે આપણે પેરેન્ટ્સ બનીએ છીએ અને આપણા આજના એક્સપર્ટ ડોક્ટર દર્શન સુરેજા એ સૌભાગ્ય ઘરે ઘરે પહોંચાડે છે. He is one of those pot of luck that a lot of families have used. And he has brought a smile to a lot of families and a lot of parents, I should say. So I'm very, very happy that I have got this opportunity from Joy Academy and DC group of cyber yogis to present this webinar. And I would like to welcome Dr. Darshan Sureja for today's webinar. Before I let him speak, I'm going to introduce him. So Dr. Darshan Sureja is an expert on IUI and infertility, so IUI and IVF procedures. He is a founder and director of Global IVF Center in Rajkot since over 10 years. He has super specialized in infertility from Germany and Singapore. He has done various national presentations and conferences, and he holds a lot of presentations all over India. And he also does a lot of paper presentations, some of which are award-winning. So we're very lucky. આપણે બધા આજે lucky છીએ કે આજે આપણા સમક્ષ ડોક્ટર દર્શન સુરેજાનો આપને ટાઈમ મળ્યો છે. So I would like to welcome him and also just reintroduce this topic is about basics of conceiving and infertility. So let's have Dr. Sureja. Without further delay, you can start.
Okay. First of all, good morning for the USA persons and good evening for the Indian persons. I would like to thank you, Joy Academy, Dr. Pradeep Kansagra sir, Dr. Drashti, Dr. Darshan, and all the people who are behind this positive platform, which they are providing free of cost, this type of educational seminars for awareness and for help of others. And I am delighted to share my views on basics of conceiving and basics of infertility, why it is increasing, what are the preventive measures, what are the investigations, and what are the basic treatments, what we all do in IUI or IVF, or what one should do before going in these type of infertility treatments. So, as Dr. Drashti has rightly said, becoming a mother means you have already heard, once a baby is born, mother is born. Otherwise, mother was also not there before it. So, what is preconceptional counseling? My topic is divided into two parts: preconceptional care or counseling. What is it? What you should do? Not only from the allopathic aspect, but it is something bringing a divine soul to your body, to your family, to your country, and becoming or nurturing a divine soul and giving a good human being to the society. So it starts from the preconception. So I will start with my PowerPoint presentation. So Dr. Drashti, will you help for the
Yes,
presentations?
absolutely. Let's go into it. Can you see that screen?
Yeah. From the first.
Okay, yeah.
Yeah.
Mm,
Full screen view
yeah,
possible?
I'll do full screen. Okay. Is that
Yes.
visible? Yeah.
Yeah. Thank you. Okay. Thank you. So, as I have already told you that the preconceptional counseling and basics of infertility will discuss in detail. Next slide. Myself, Dr. Darshan Sureja, practicing infertility since last 10 years at Rajkot Global IVF Center. Next slide. So, as we all know, if you are planning to build your house or your factory or your hospital, first of all, what you will need? You will need a good plan. Okay, so and so hospital, you will visualize, okay, I should have this type of hospital, this type of house, this room's color, this would be the furniture, and you will consult a architect. So it is the same. Have you ever planned? Because most of the pregnancies are unplanned. So better to plan for the pregnancy and then you conceive. Next slide. So there should be a goal, means there should be a plan. Okay, you are having or you are planning to have certain kind of quality in your baby. These are the options, whichever kind, whatever you like your baby to be: a good politician, a good orator, a brave person like Shivaji, Mother Teresa, Narendra Modi, Swami Vivekananda, whatever is your belief or whatever is your plan, but you should have it in beforehand. Second thing is, for building your hospital or home, you should select a good land. So nature is also selecting, but your land is your body. Means you should have a proper fitness to bear a child. And to consult a good architect is to consult a good doctor. Before planning, you should have a brief overview regarding your fitness. Okay, you are fit or not, or you will have to have other supplements, which we will see in detail in next slide. So it is divided in two parts. One is physical, other is mental. Physical, it's a bodily part. Next slide. First of all, once you consult a doctor, they will ask for a certain investigations. For husband part, semen analysis is the basic investigations. Sometimes, we have encountered many patients of infertility. They have visited one to another to another hospital, and they have been investigated for the infertility for wife only, and husband semen analysis not done. But there might be a factor with husband semen, so it is also one of the basic investigations to be done to start with. If it is normal, okay. Next thing is wife's blood investigations in form of hemoglobin, hormonal reports, thyroid, prolactin, sugar, thalassemia, blood group, and rubella immunity. If there is no rubella immunity, they can go for rubella vaccination and then they can plan for pregnancy. These are the investigations, and also a good transvaginal sonography means the anatomical structure of uterus and ovaries are okay. If it is all okay, they can go for the pregnancy. Second part is fitness. Fitness regarding the diet means you should have a proper diet. I advise my patients, once they consult, they are complaining of GI complaints, for example, constipation or nausea or gaseous, they are having bloating sensations. But I advise my patient, if you buy a Mercedes and you will fill only kerosene, then you will complain for the company that the car is not working properly, or the mechanic will help once in a while that they will clean the all the dust in your filters. But whatever you put in your body, it's like a better than Mercedes. It's a Rolls Royce that God has given you, that you should put a healthy diet in your body, because you should be aware that you are going to bear a child. You are going to develop a soul or a small baby in your body. So once you plan for eating a junk food, just have this thought in your mind and you will change it. Second thing is maintaining your weight, means not overweight and not on the thin part. So according to the BMI of your body, you should have a diet and also exercise. In exercise, either aerobic exercise, swimmings, whatever you are comfortable with, but exercise is also a must to make your joints everything healthy, because in pregnancy there are lots and lots of changes in your all the system, starting from the cardiovascular system to the musculoskeletal system. So you should exercise to help all the systems to be in the normal limits. And basic drug supplements in form of folic acids and multivitamins to avoid spina bifida or other neural tube defects. So drugs, fitness, and basic investigations, these are the physical part. Next slide. And other is the mental aspect in form of relaxation and sleep, because relaxation is also one of the most important part, because if you are not relaxed, if you are using more of mobile and more of internet use, so your energy will be diverted towards the negative things, because you have to conserve your energy to bear the child. So proper relaxation, proper sleep is also a important aspect in your preconceptional journey. Next slide. Basically, how does it works? Basics of conception. This is a figure, this is a picture showing a uterus in between, both side white color small ovary, and the tubular structure is a fallopian tube. You should have a knowledge of fertile period when the pregnancy occurs. Basically, uterus must be good to hold the pregnancy, ovaries should be producing good eggs, and the tubes must be open to travel the eggs from the ovary to the uterine cavity. This is the basic picture which I have to explain. Next slide. So what is the fertile period? Sometimes, the couple is not having awareness regarding the fertile period. In 30 days of menstrual phase, there are only 2 days when your egg is ovulating or when you are fertile. So once the menses starts, is the first day. So if you are having a regular menstrual cycle, you means 30 days of menstrual cycle, your egg would be ovulating on 15th day of your menses. Means the first day would be starting of your menses and 15th day would be ovulation period. So to detect the ovulation period is one of the most important thing. So first 7 days and last 10 to 12 days are not important for pregnancy. So the couple should try 2 days before and 2 days after 15 days, means starting roughly from the 11th day to 18th day of menses. So they will catch the fertile period and they will have pregnancy. This is a rough estimation. There are other investigations or other factors that can help to detect the fertile period, ovulation period. Next slide.
Oh,
next.
Sorry, I'm just
Yeah.
having some. It's not letting me out of here.
Okay, you just change. I'm continuing. The
Okay.
second thing is ovulation kit. It is a kit which can a couple can detect. It is like a pregnancy test, urinary pregnancy test. Dropping of female's urine, starting from around 12th day of menses. Keep a drop on this kit. There would be one line. It is an infertile period. On 14th day, keep again a urine drop. There are 2 lines, means the fertile period has started. You start trying and stop doing the ovulation kit. So this is the second number option for detecting the ovulation. Third number and what more perfect is follicular monitoring. This is a sonography picture showing the follicles which we can detect. A gynecologist or radiologist can detect a good follicle develop and it is ruptured, so they can give you a perfect timing for ovulation or for natural trial. Next slide. So now comes the spiritual aspect. This is a Garbh Sanskar, which in India we are telling our patients, or we are giving them many things. Means before starting, you are planning that your child would be having a good mathematical skills, good listening skills, good music, good diet. Every day they are giving a different diet recipes. They are giving diet, different meditation musics, different mathematical skills the mother has to solve, means the baby is also going to solve. It is a pre and post conceptional I am talking about. And there should be a goal chart, means you have to visualize this type of qualities I need in my baby. Next slide. There is a nowadays, you can have a different types of goals, means you need get this type of hairs, you need this type of eyes you need of your baby. So we have many patients, they show our goal chart. Doctor, I have told that I needed this type of curly hair in my baby, and see, this is the baby which I have planned. So they have got the result. It is our ancient science, which that Shivaji and Jijibai, that Jijabai has planned it, and they have given it all the sanskaras and gunas in the preconceptional or conceptional phase, so that the Shivaji has been born. So we need more of the Shivajis to keep our nation more strong and keep our society more strong. Next slide. So conceiving means bringing a new soul to world. It is not just like a conception કે ભાઈ એસે pregnancy plan થઈ ગયું અથવા તો pregnancy conceive થઈ ગઈ તો continue it, but you should plan it as we have discussed earlier. Next slide. So sometimes I ask my patient, okay, you follow the diet, so they ask that, oh, I'm not able to follow it perfectly, what should I eat? But giving the concept, explaining them in detail, that it is like cleaning your home before any guest comes. Each and every year on Diwali time, we Indians clean our houses. So it is some new soul, new body is going to generate in your female's body. So you should clean it before. There are other therapies in Ayurveda, that panchkarma, body cleansing, massaging. So these all are having good effects on your preconceptional planning. Next slide. So this is all regarding the preconceptional. There is a separate lecture for the preconception, because due to the shortage of the time, we'll go to the next topic. When one should consult a doctor for fertility treatment. This is for preconceptional, which we have talked up till now. Definition. Sometimes certain patients are coming to us, okay, we are doctor, we are trying since last 2 to 3 months and we are not getting pregnancy, so we are more worried. Or sometimes, even after 5 years of trying, so they tell that, okay, we want to go for more natural conception, and we are having more patients. But this is not the case. Couple actively trying since 1 year for conception and not getting the success, they should consult a doctor. And if age of the female more than 35 years, they should consult after 6 months of actively trial. Nowadays, definition has slightly changed, that after 6 months of actively trial, they can consult a doctor. And if every investigations are normal, they can try furthermore for 2 to 3 months or 6 months, and they can, afterwards, they can start the treatment. Next slide. Out of 100 couple trying, sometimes they are more worried, they are more stressed in our routine day-to-day OPD. Per month, natural conception success rate is only 10%. Out of 100, only 10% will get pregnancy. 80% would get succeeded in 1 year, mean first year of trial. 10% would need help of doctors, and they will succeed in next second year. 10% would need more and more detailed treatment. Because basics of conception, there are 10 steps of pregnancy conception. Means once the follicle is developed, it is ruptured. Once it is ruptured, it is live for 2 days. in those 2 days, if the couple tries, the semen is deposited into the vagina of the woman. Semen quality is good, egg quality is good, fallopian tubes are patent, sperms got travel into the fundus of the uterus, egg gets travel to the fundus of the uterus through the fallopian tube. Both egg and sperm meets together and good embryo is developed. If good embryo is developed, implantation must be good. Implantation means the embryo sits into the uterine wall and it sticks to the uterine wall, and then the pregnancy occurs. So there are 10 steps which must be followed in rhythmical manner. If only one step is removed, there is no pregnancy. So 10% success rate is per month. Next slide. Next slide. It is increasing, incidence is increasing day in and out. Incidence is 1 in 6 couple, and as the age increases, the infertility increases. Next slide. Next slide. Why it is growing infertility? જે વડીલો આમાં જોઈન થયા હશે એ લોકોને એવું થશે કે ભાઈ આ ટોપિક તો જ્યારે એ લોકો ત્યારે આ ફેઝમાં હતા અથવા તો નાના હતા ત્યારે તો આવું કંઈ એટલું સાંભળ્યું પણ નહોતું કે ભાઈ why infertility is growing like this, because it was there but it was not so rampant. It is like a non-communicable disease like diabetes and hypertension. આપણે નાના હતા ત્યારે ગામમાં એમ થાય કે એક બીપી એક ડાયાબિટીસનો હાઇપરટેન્શનનો કેસ હોય તો બધાને એમ થાય કે ઓહો એ બાપાજીને કે બાને બીપી છે. Now there are 1 or 2 cases per family, or rather more than that. So infertility is also growing like that due to delayed marriages, late childbearing. Even per month I am treating 10 to 15 doctors of my fraternity or my friends or colleagues having infertility because of social stabilization, for educational purpose, they are delaying the conception. Due to STDs, pollution, diet, lack of exercise, previous contraceptive use leading to sterility, and sterility from previous abortions, and falling sperm count in males due to bad habits in form of medicines and alcohol. In alcohol, I want to give one example. There was one patient who had one female child. She was of 5 years, and for second conception, his semen count was down. So he was surprised that, oh, my semen count is down. How could it be? And I asked him that you stopped smoking. So he told that I was smoking before my first child also. So why it is down? So that I explained him that, for example, you have smoked for 20 years before the birth of your first baby, and now you have smoked for 25 years before the birth of your second baby. So more and more you go for bad habits in form of smoking and alcohol, there is something damaging your DNA in the sperm. So the DNA fragmentation index of the sperm is getting increased, and they are not able to fertilize the egg and not able to produce a good embryo. And finally, the infertility occurs. Next slide. So causes of infertility, as we have already discussed, there are all 2 factors, all female and male, both partners are responsible. Sometimes, in certain societies of our certain class of our society, they feel like that if we ask for semen analysis of husband, so they will ask that no investigations of male. I am totally healthy, you investigate wife, and there are problems in male only. So 40% is the female, 40% is the male, and 20% is the combined factors responsible for the infertility. So you should assess both the partners simultaneously. Next slide. So how we assess means what are the basic causes of infertility? Starting from the hormonal causes and the local causes. Hormonal causes, if pituitary factors, because in pituitary there are thyroid, prolactin, and other hormones like FSH and LH released, and they stimulate the ovaries to produce the good female eggs. So either the hormone which are controlling your ovaries or which are controlling your menstrual cycles are at fault, or the local part means, next slide, local part means uterus is having more fibroids, tumors, uterine wall is thick, your cervix is not holding the baby, your fallopian tubes are blocked, or for the ovary, patients are having PCOS, polycystic ovarian syndrome, means the follicles are too much compactly packed that they are not getting released. Or nowadays, last 3-4 years, we are seeing young age with poor ovarian reserve. This all I am saying is each one is a different topic, but due to shortage of the time, I have to hurry up. So the PCOS, poor ovarian reserve with young age, these are the factors which are responsible for the infertility for female partner. Next slide. For the male causes, the same thing. Assessment of the hormonal, pituitary, thyroid, prolactin, and testosterone. And for the semen, either the semen count would be less, semen count would be 0 sometimes. Sometimes semen count 0. Then also we can give them their biological child by going into the testis, by putting a needle inside the testis, and we will retrieve certain 5 to 10 sperms and giving them pregnancy with IVF. Next slide. So for sperm, there might be a simply I explain to my patients, once you open a tap, if the water is not coming, there might be a problem of transportation, or there might be no water into the well. So sometimes the production failure at the testis means the total azoospermia would be there, or there might be a blockage of transportation of sperm, so that TESA means putting a needle will help to get a sperm. Same for the wife investigations, we have discussed that hormonal investigations, good transvaginal sonography means the uterus and ovaries are good. After that, we go for tubal testing, means the fallopian tubes are open or not. Putting a dye inside and having an X-ray of the fallopian tube, it is called hysterosalpingography. I think those who are hearing and those who have underwent hysterosalpingography, they would be having a horrifying experience of hysterosalpingography, because it is one of the painful procedure. But we have shifted to sonosalpingography to be done under sonography and with short general anesthesia. So it would be a painless experience for the woman. And if the tubes are further blocked, so we can go for laparoscopy or hysteroscopy. Next slide. So this is a good 3D view of uterus. So if there are septums, means we are having a septum in our nose, sometimes polyp. So if you believe it is a uterine cavity, so holding a pregnancy would be difficult if the room size of the uterus is not good. So you have to clear the factors which are inside the uterus. Means if there are septum genetically or by birth, so you have to cut by hysteroscopically, or you remove the polyp and then they can go for the pregnancy. Next slide. This is the procedure of sonosalpingography. It is a small procedure, putting a small Foley's catheter or a balloon inside and keeping a betadine saline and visualizing it with the sonography. Next slide. This is a picture how we see in the sonography. This is the color showing a free flow of dye, and the white shadow in the first picture showing a free flow of the air bubble, and showing the patency of the tube in sonography, which we are doing. Next slide. This is the HSG, hysterosalpingography. In center, it is a uterus, and both the tubes are having photographed in the X-ray. Next slide. This is a laparoscopic view. You know, visualizing the uterus. This is a uterus. You believe a room. You are watching it out. Watching it from outside means the first picture is showing the laparoscopic view. Means the uterus is seen from the outside. It is called laparoscopy, and visualizing the uterus from the inside. Next slide. From the inside, this is a hysteroscopic view. As I told that something inside the uterus, you can clear it from that way only. So once there is problem, you have to go with laparoscopy and hysteroscopy, because both views are different. Previous slide. See, the laparoscopic view, once you put a dye, and this is a second picture showing methylene blue dye coming out of the fallopian tube, showing it is patent. So in laparoscopy, what you can do is the problems with ovary, if they are having PCOD, you can go for drilling. If there are adhesions, intestines are stuck with it, if there are chocolate cysts, if there are fibroids in the uterus, you can treat it by removing the fibroid and stitching it. And next slide. If there are uterine factors in form of septum, sometimes, some have congenital birth defects. They are having biconjugate uterus, means uterus is divided in two parts with the septum, or there are adhesions due to previous abortions, means the uterine cavity is like a sandwich, which once you pour a saline, it will distend. But if there are adhesions, means once there is a stitch in your skin, so there are adhesions. So it is the same like in uterine cavity. So it will not expand even for the pregnancy. So you have to go inside and do adhesiolysis, and the uterus is expanded. Next slide. Next slide. Now comes the male factor. As we have already discussed, we have to see for the previous paternities. Previous paternities means sometimes, second marriage or previous childs are there. So we generally believe that they might not be major factor for the male partner. Sometimes, sexual dysfunctions in form of they are more stressed, they are not able to perform. So due to stress, but once we ask for that, this is the fertile period, they are more stressed, they cannot try or they cannot have pregnancy or otherwise they are able to give the sperm. Mumps, previously by otherwise, in childhood era, there might be a mumps which is untreated. So the high grade of fever damaging to the sperm producing cells permanently. So, at that time we don't know, but when we see the sperm count, when they are going to plan a baby, so there would be a 0 sperm count. There might be some traumatic history, trauma to the testes. So they are also damaging the sperm. Undescended testes, sometimes the testis is inside the abdominal cavity of the male. So they must be operated and to be kept into the that testicular area. Previous investigations you have to go through, past medical history, patient is having diabetes or any surgical history, medications or cigarettes or alcohol. These are the basic histories. If doctor is taking or you are giving a good history, they can have a definite idea regarding your infertility. Next slide. Previous slide. Okay, next slide. Okay, the basic semen analysis and other investigations in form of sugar, blood group, infective profile, and if there is problem in semen analysis, we have to go for LH, FSH, prolactin, testosterone, and if there are multiple missed abortion histories, we have to go for karyotyping. One gastroenterologist just before 1 year I have treated. So we have kept 2 embryos. She has a pregnancy, twin pregnancy, and suddenly the heartbeat stopped. So we were finding what was the reason. Otherwise, everything was fine. So we assessed there was a chromosome number 9 having translocation problem, minor problem in male partner, which was causing the missed abortion in the child area. But the parents asked me, I am healthy, my wife is healthy, then why this type of karyotype problem? But certain karyotype problems are that if you conceive for 10 pregnancies, there might be normal pregnancy for 9 and 1 would be having abortions. So there are definite causes which we can find and help the couple to have a healthy baby. Next slide. These are the normal healthy sperm looking. Sperms are having head, neck and tail. So they are, once you see in the microscope, we assess it with by જેમ આપણે કહીએ ને કે ભાઈ if there are a fair, આપણે મેળો હોય તો મેળામાં માણસો આપણે જોતા હોય, તો it is something like that કે જોઈએ કે કેટલા માણસો છે, એમાંથી કેટલા દોડતા જાય છે અને કેટલા structurally normal છે. So this is how we analyze the sperm. The second picture is showing low sperm count. In high power field, there are less sperms. The third picture is showing abnormally shaped sperms. The head part is large. There are double heads, double tails. So these are the poor sperms. Certain laboratories are giving normal reports, but there might be some abnormally shaped sperm which are not able to fertile. The count is normal. The motility of the sperm is normal, but there might be a genetic problem or abnormally shaped sperms which are hindering the success rate. Next slide. So there are criteria of semen analysis by WHO, which were previously was more than 20 million count, more than 50% mortality, but nowadays it has slightly changed. Next slide. 1.5 ml volume is okay. Sperm concentration more than 15 million per ml is okay. Progressive motility of the sperm is 32 to 40% is okay. And if 96% of sperms are abnormal, then also it is okay. Means more than 4% normal sperms are okay for the pregnancy. This is the WHO 2010 criteria for male infertility semen analysis. Next slide. Now we'll go to the treatment aspects. What are the treatment aspects when a couple approaches to us? What we usually start with? Next slide. Before starting the treatment, the concept of treatment is important, because sometimes patients give a call that so and so I am having poor semen count, what should I do? But it is not like that. The age of the partner, female and male, the duration of infertility, means the if semen counts are less, and if they are trying since last 3 months, and if they are trying since last 13 years, so both are having different treatments. Primary versus secondary infertility. Primary means they have no pregnancy till date, because I have treated many patients having married life of 30 years and no child, and once we do a IVF, they are having a good baby. So sometimes secondary infertility means there are 20 or 22 patients having lost their 18, 20, 22 years son or daughter in certain type of accidents, and again we had done IVF, and they are having 2, 3, 4, 5 years of child. So they are called secondary infertility. I think from next month I'm going to start one of the couple having lost their baby in Morbi, that pool Honarat, just before a few months we have heard about. So they lost one of their male child. So we are going to start IVF for that couple. So multiple causes of infertility would be there. Certain semen count is also low, tube also blocked, and uterus is also having fibroid. So these are some of the difficult cases. So you have to rule out all the causes. ઘણી વાર હું પેશન્ટ્સને સમજાવતો હોય કે ઇલેક્ટ્રિકનો પેનલ બોર્ડ હોય ને, તો ઘણી વાર પેશન્ટ્સ ફાઇલ લઈને આવે કેમ કે બધું નોર્મલ છે પણ તોય નથી કન્સીવ થતું. પણ હું એમ કહું કે આટલા ઇન્વેસ્ટિગેશન્સ કરાવવાના થશે, તો એમ કે બધાય કરાવવા જ પડશે, કારણ કે ઘણી વાર પેશન્ટ્સ એમ કે બહુ રિપોર્ટ્સ કરાવડાવ્યા. એટલે હું એમને સમજાવતો કે ભાઈ વન્સ ઇલેક્ટ્રિકનું પેનલ બોર્ડ છે, તમે એમાં પાવર આપો છો પણ છેલ્લે સુધી બલ્બ નથી થતો, એનો મતલબ કે ક્યાંક પ્રોબ્લેમ છે. તો યુ હેવ ટુ ચેક each and every connections, કે where is the problem, and you have to tight all the screws, and then you can have a pregnancy. So there is a soft fertility versus sterility also. Means you will help in simple by simple treatment, by increasing the semen count, or by having a good diet and good sleep, so they can have a pregnancy. Everyone not need a IVF. One patient I will give example. One couple coming from Morbi, he is a import exporter. He was telling that they are having partnership for other businesses with 2 other IVF centers. They have already told the couple that they should go for IVF because married life 14 years and semen count was borderline low, and the wife has undergone bariatric surgery. So they have been referred to me with one of our patients કે ભાઈ ભલે તમારા ઓલા પાર્ટનર હોય પણ તમે ક્યાં ગ્લોબલ હોસ્પિટલમાં સુરેજા સાહેબને એકવાર તો બતાવો. So the couple came, I told that you can go for IUI treatment, which is a smaller treatment and with low cost. So they told that કે આ તો તમે બહુ આગ્રહ કરો છો એટલે કરી લઈએ સાહેબ એકવાર. એટલે પછી મારે એને ઊંધું સમજાવવું પડે કે તમને IUI માં રહી જાય તો નુકસાની મને છે, કારણ કે it is a low cost treatment. તો એ કે કાંઈ વાંધો નહીં સર, તમે કહો છો તો એકવાર કરી લઈએ. તો વન્સ અમે IUI કરી લીધું એક ટ્રાય, મેં કીધું એક ટ્રાય કરીએ. તો એક ટ્રાય કર્યું, પછી જ્યારે રિઝલ્ટ આવ્યું ને તો વાઇફ વેન્ટ ટુ હસબન્ડ ઇન ધ રિસેપ્શન એરિયા વિથ ક્રાય કે ભાઈ ઓ કે રોતી રોતા બેન ગયા. તો હસબન્ડ કે કાંઈ વાંધો નહીં, શું મૂંઝાઈ ગયા, આપણે તો IVF કરવાનું જ છે ને. એ કે રોઉં છું એટલે કે મને પ્રેગ્નન્સી રહી ગઈ કે પેલા IUI માં જ. So she was more delighted. અને હવે તો હમણાં એની ડિલિવરી થઈ, જસ્ટ એનું બેબી 3 months નું થઈ ગયું. એટલે ઇવન એને અહીંયા બાર સ્પીચ એવી દીધી કે ડોક્ટર મને કહેતા હતા કે નુકસાની મને છે, કે પહેલા હું નહોતો માનતો, પણ again we went for a simple treatment of IUI and we got a pregnancy after 14 years of married life. એટલે કહેવાનો મતલબ એવો છે કે sometimes a smaller treatment is also going to help, but you should have a perfect diagnosis. Next slide. So starting from assessment, ovulation induction કે means આપણે એને બીજ બનવાની ગોળી દઈએ કે ભાઈ follicle develop થયું, follicle rupture થયું, તો કે yes it has ruptured, now this is the time you go for natural conception. Second option, you go for IUI, intrauterine insemination of sperm. એટલે કે keeping a good quality of sperm into the uterine cavity. It is called IUI. It is a simple procedure and nothing to worry about. Once your doctor advise you go for IUI, it is an easy procedure. But you know, sometimes they have undergone HSG, hysterosalpingography. એટલે patient એમ કે મારે કાંઈ કરવું નથી, એટલે કે ડરી ગયા હોય. But IUI is a simple and non-invasive procedure and you can definitely go with IUI. Third step is IVF, in vitro fertilization. એટલે basically બધા શું કહેતા હોય IVF એટલે શું છે? ઘણા અમારે એમ કહેતા કે ભાઈ what is test tube and what is IVF? It is same thing. they ભાઈ Colgate અને toothpaste માં શું ફેર છે? તો કે same thing છે. એટલે કે in vitro fertilization, the fertilization procedure means meeting of the two gametes, sperm and egg, which is taking place into the body of woman. It is to be taken care in the lab. Okay, in vivo fertilization means fertilization in the body, in vitro fertilization into the lab. ICSI is an advanced procedure of IVF, intracytoplasmic sperm injection. Next slide માં વધારે ડિટેલ સમજાવીશ કે જે સેલનો સાઇટોપ્લાઝમ હોય, એગના સાઇટોપ્લાઝમ, એની અંદર સ્પર્મને પકડી અને ઇન્જેક્ટ જ કરી દેવું, that is called ICSI. Other procedures are surgical sperm collections, means they are having zero sperm count. So going into the testis and removing the sperm from the testis is surgically collecting the sperm. And if these are not possible, means they are having a zero sperm count, zero eggs, after menopause, we have many patients who have menopause since 5 years, 4 years, means 55 years, 40 years, and we have given them a good healthy baby. So we have to go for donor sperms or donor eggs. Next slide. So basically, you know, for semen count, if you are having 20 million count per ml, 50% mortality, you can try for natural conception, but female partner should be normal. 10 to 20 million count, 40 to 50% mortality, you can go for IUI. Less than 10 million count, less than 40% mortality, we have to go for IVF. This is a rough estimation. This is not a perfect, because all as I have discussed, that the duration, female partner and everything should be assessed. But if others are normal, the semen count rough criteria would be this one. Next slide. So what are the indications of IUI? Retrograde ejaculation. Sometimes, you know, patient would be going for cancer surgery, cancer treatments, and we ask them, you better go and preserve your sperm. Minus 196 degrees centigrade, we preserve their sperms. And once after 2 to 3 years, male partner is healthy and they are planning for the baby, because you know, oncotherapy or surgical any procedure near to the testis will damage the sperm producing cells, and we have sperm and we can give them a pregnancy with the stored sperm. Unexplained infertility, cervical factor, you know, cervix is something problematic. Cervix is not able to let the sperm travel to the uterus. Then we can help with the IUI. And husband is away from wife. Sometimes, you know, we are having many NRI patients, or we are having army persons, so they are not here. So we'll take their sperms and 2 to 3 samples in our lab, and we'll do IUI as per the wife's menstrual cycle. And sometimes abnormal male factors, oligospermia, asthenospermia, or abnormal sperms in form of teratospermia. Next slide. So what is IUI? Doctor will give you tablets, monitor 2 to 3 times with sonography. This is the first picture showing a good follicle development round on the right side. 2 to 3 follicles are developed, and the lower side on right side, uterine picture means the endometrial cavity is also growing good. If follicle is good, endometrium is good, they will give you HCG injection and will wash the semen. Next slide. And this is the injection and keeping the good wash the sperm into the fundus of the uterus, and the sperm will travel from the tube and will go to the egg. Next slide. This is the IUI. Why we wash the semen? Because concentrating good motile morphologically normal sperm and keeping into the small volume and keeping into the fundus of the uterus. Next slide. So basically, IUI is simple, non-invasive, cheap, and selection of patient is more important, and it is a cost-effective treatment. But 4 to 6 trials of IUI failed, you have to go for IVF. Next slide. These are the other factors. If there are varicocele, means vein dilated, you can go for varicocele ligations, other hormonal treatments, antioxidants, sperm vitalizer, or other factors are there. Next slide. So now coming to the IVF, in vitro fertilization, test tube babies. Next slide. What is it? Indications: prolonged unexplained infertility, married life 15 years, 20 years, tubes are blocked, or ectopic pregnancy has occurred, severe male factors, some semen count are low, congenital bilateral absence of vas, means the transportation is not good, the tube vas deferens is absent or blocked, obstructive azoospermia, or IUI have been failed, so they have to go for IVF. Next slide. So success rate of the IVF would be around 40 to 50%, or max 60 to 70%, because nowadays IVF has been more refined in form of freezing of the embryos, and we are able to achieve our success rate up to 80 to 85%. And nowadays we are transferring single embryo transfer to give a gold standard. It is single embryo transfer because always a single pregnancy is good pregnancy. But to get a good pregnancy rate, we might be transferring 2 or 3 embryos to have a good success rate. Next slide. Next slide. Sometimes, the patients discuss why we are not getting 100% success rate in IVF. Because, in IVF, getting the sperm, getting the eggs, developing good embryos, keeping it into the lab, developing the good embryos on 5th day, ટ્રાન્સફરિંગ ઇટ ઇનટુ ધ યુટ્રસ. એટલે હું સિમ્પલ પેશન્ટને કહેતો હોય કે જમીનમાં આપણે બીજ વાવી દઈએ, ફર્ટિલાઇઝર નાખી દઈએ, પણ બધાય બીજ ઉગી જ નીકળે એવું જરૂરી નથી. મીન્સ કે તમે 2 કે 3 એમ્બ્રિયો મૂકો તો કોક એવું બીજ છે કે જે સરસ રીતે અંદર સ્ટક થઈ જશે અને એ ઉગી નીકળશે, એટલે કે તમને પ્રેગ્નન્સી રહી જશે. પણ સમટાઈમ્સ there are 15 to 20% કેસીસ કે બધાય એમ્બ્રિયો ચોટે નહીં, અથવા તો તમને સક્સેસ રેટ ન પણ મળે. કારણ કે અમે પેશન્ટ્સને કહેતા હોય કે ઇટ ઇઝ અ નેચરલ પ્રોસેસ ઓર નેચરસ પ્રોસેસ વિચ વી આર હેલ્પિંગ એટ ડિફરન્ટ સ્ટેપ્સ. કારણ કે જો અમે જ 100% કહેવા માંડીએ તો પછી ઉપરવાળાને કોઈ યાદ ના કરે. એટલે બેઝિકલી સ્ટાર્ટિંગ IVF, બેઝિક પ્રિન્સિપલ્સ ઓફ IVF શું હોય કે હાર્વેસ્ટિંગ ધ એગ્સ મીન્સ starting from the 2nd day of menses, we give 10 to 12 days injections to the female, developing good quality or good number of eggs, retrieving the eggs by transvaginal sonography under anesthesia, retrieving good sperms, mixing it into the lab, developing the embryos and transferring to the mother. This is the basic principle of IVF. Next slide. There would be a specialized operation theater with good sterilization facility, and this is a transvaginal probe which we keep into the vagina of the uterus, and one needle is connected to the test tube, and test tube is connected with the vacuum pump. એટલે the picture is showing a sonography picture on the right upside. So by sonography guidance, એટલે એમાં no incision, no stitch, no night stay in IVF home pickup. Even in all IVF procedure, they not need 24 hours admission. It is a daycare procedure, but to be in short general anesthesia. So the eggs are retrieved into the test tube, and the follicular fluid which we aspirate is transferred to the IVF laboratory. Next slide. This is the picture which I was telling, that putting a needle into the testis and retrieving the sperms if there are azoosperms. Next slide. This is a specialized IVF laboratory. The embryologist will now get or separate the good sperm, good eggs, and there are specialized microscope with which we are going to combine them. Next slide. These are the incubators. What is it? Incubators are like environment providing like a womb of the mother. Means 5 days of embryos are going to develop in this type of incubators. There are different incubators, simple CO2 incubator, tri-gas incubator. But nowadays these tri-gas incubators are providing best results and developing good number of blastocysts. Means 5th day of embryos is called blastocysts, good quality of embryos. Next slide. There are different types of medias. Medias એટલે આપણે હું કહે કે ભાઈ આપણે જમવા માટે શું જોઈએ, દાળ ભાત જોઈએ, રોટલી જોઈએ, શાક જોઈએ. So these are different type of medias in which we keep the embryos કે જેની અંદર embryo cell division એટલે કે તમે નેચરની કેટલી કૃપા છે કે ભાઈ એક સ્પર્મ અને એક એગ બંને ભેગા થઈ અને સેલ ડિવિઝન થઈ અને આખું તમારું બોડી બને. They are going to develop bone, they are going to develop heart, pancreas, and everything is going to get developed with these two cells. So these are the medias in which they are having different requirements day wise. Day one, they require flushing, other blastocyst culture, simple other cultures. There are different types of media which will change according to the requirement of the embryos. Next slide. So this is a basic picture showing ICSI, intracytoplasmic sperm insemination. From one end, from the left end, eggs are being held, and from the right end, the needle which is injecting the sperm into the cytoplasm. This is a ICSI picture, intracytoplasmic sperm insemination. Next slide. This is a specialized micromanipulator with which we are going to do the ICSIs. You know, the needle which we are holding the sperms are 10 times thinner than our hair. So they are difficult to manipulate with our hand, but there are micro manipulators outside. This is a micro manipulator joystick. Like once you are doing a macro movement outside, there are micro movements done to inside the our petri dish. So this is a very skillful procedure. You should have a skilled embryologist which can give a good ICSI in short time, and they are again transferred to the incubators for the further growth. Next slide. So these are the days wise development. First day, nucleus of the cells comes, cell division occurs, and day 3 and day 5. Next slide. These are the multiple cellular development, and on day 5 we transfer the embryo into the womb of the mother, into the uterus under sonography guidance. Next slide. And after 17 days we assess the pregnancy with beta HCG or with sonography. These are the other therapies. If the patients are having menopause or they are having exhausted their eggs, we have to take a donation of the other's woman egg and make embryos into our lab and transferring into the same recipient, and they are having their child from their womb. Sometimes sperm counts are 0. We have to go for sperm donation, and sometimes uterus is not there by any reason. They have been undergone multiple missed abortion, they have undergone hysterectomy. Then also, if they are producing egg, we can collect the egg from the woman, sperm from the husband, make the embryo and transfer it into the other lady, and after 9 months they can have their own biological child. And other things are eggs and sperm freezing. Egg freezing, nowadays some more in USA, they are going for social egg freezing. Means they have not decided a partner yet, and they are having a 35 year of age or 32 year of age. They go to the IVF center, they go and freeze their eggs. Okay, once I will decide for the pregnancy, I will come back and use these eggs, because once the age of the woman increases after 37 or 40, especially for our Indian continent, it would be around 35 or 37. The eggs number would decrease drastically and they will approach menopause fast. So they can go and freeze the eggs. And sperm freezing is also an option for the cancer patients. Next slide. Thank you for the wonderful listening. Next slide. A baby fills a place in your heart that you never knew was empty. Next slide. Yes. This was all about the lecture. The session is open for the question as per the Dr. Drashti tells. Thank you.
Okay, thank you. Okay. So thank you so much, Dr. Sureja, for the insightful information. I think ઘણી બધી વાતો એવી હતી કે જે આપને ના ખબર હોય, ફોર એક્ઝામ્પલ એજ રિલેટેડ ઓર સ્મોકિંગ વાળું જે એક્ઝામ્પલ તમે આપ્યું કે 5 years પછી સ્મોકિંગ કન્ટિન્યુ હતું અને વધારે હાર્મફુલ હતું DNA માટે એ વાળું. But I think the highlight was about diagnosing the right problem. So it is not that you will need IVF. You might just get away with a simple procedure like IUI. So it is important that you consult with your doctor. Just a disclaimer, with Joy Academy, we usually give all general information. So it is important that you personally see your doctor and find out what is more appropriate for you. Most information અહીંયા આપેલી હોય એ generic અને general information આપીએ છીએ. ઓકે, હું ડોક્ટર પ્રદીપ કણસાગરાને રિક્વેસ્ટ કરીશ કે એ થોડીક વધારે ઇન્ફોર્મેશન ઓન મેલ પેશન્ટ્સ. રેડી, તમે મ્યુટ ઉપર છો.
Great job, Darshan. Congratulations, Darshan and Drashti.
Thank you.
Informative. ખૂબ સારી ઇન્ફોર્મેશન આપી. હું યુરોલોજીસ્ટ તરીકે પ્રેક્ટિસ કરતો હતો રાજકોટમાં 1978 થી. એટલે મારે મેલ પેશન્ટ ઘણા આવતા. તે હમણાં કહ્યું ને એમ કે બંને ઇક્વલી રિસ્પોન્સિબલ હોય. મને એક ઇન્સિડન્સ યાદ આવે, જો કે ઘણી વખત ઘણો જુદા ઇન્સિડન્સો ઘણા બનતા, પણ એક ઇમ્પોર્ટન્ટ હતો. એક મારા પથરીના પેશન્ટ છે ને, એ બહાર ઉભા હતા વેઇટિંગમાં. એટલે દક્ષાબેન, કલ્પનાબેન મારા ભાભી છે ને, શી ઇઝ અ ગાયનેકોલોજીસ્ટ. એટલે હું બહાર નીકળ્યો હતો, ઓપરેશન થિયેટરમાં જતો, તેને પૂછ્યું, જુમાભાઈ કેમ તમે આવ્યા? તો કે મારા વાઈફ, અમારે બાળકો નથી થતા ને મારા વાઈફને બતાવવાનું છે. મેં કીધું ઓકે. પછી ટ્રીટમેન્ટ, મેં કીધું કઈ કામકાજ હોય તો કહેજો, એને મારે કહેવાય તો નહીં, મને બતાવવું જોઈએ તમારે એમ. પછી 6 મહિના પછી પાછા આવ્યા, ત્યારે બીજા બેન હતા એની સાથે. એટલે મેં કીધું જુમાભાઈ કેમ છો? એ કે આ જો ને મારે બીજા લગ્ન કરવા પડ્યા, મારે વાઈફ ને બાળકો નથી થતા. મેં તો તમારે તપાસ કરાવી જોઈએ. કે ના ના, અમે થોડા તપાસ કરાવી, કે સમજ્યા? અરે જે રોજ પ્રોબ્લેમ થાય છે ને, એવા મને વર્ષો પહેલા બહુ થતા હતા. અને તમે યુ આર વેરી લકી because of advancement in engineering. તમારે બધું સરસ રીતે જોવાય, દેખાય. સોનોગ્રાફી, અમને તો સોનોગ્રાફીની ખબર જ નહોતી પડતી ત્યારે, બરાબર? એટલે પછી મેં કીધું તમે તપાસ કરાવી. કે ના, હું ના તપાસ કરાવું. ફરી વખત એને બીજાને ના થયા ને બાળકો, પછી મારી પાસે કલ્પનાબેન આવ્યા અને તપાસ કરાવ્યું, તો એમનો પ્રોબ્લેમ હતો અને પ્રોબ્લેમ વોઝ ક્યોરેબલ. તે હમણાં પેલી વાત કરી ને, ડાયલેટેડ વેસલ્સ હોય એના માટેનું, તો એ અમે ઓપરેશન કરી દીધું એને. પછી તો 2 વાઈફ ને 4 બાળકો થયા, સમજે? એટલે લાઈન લાગી ગઈ. એટલે સમટાઈમ્સ મેલ, પણ અમેરિકામાં આ પ્રોબ્લેમ નથી. મેલ અને ફિમેલ બંને ચેકઅપ માટે જાય. અને હવે તો ઇન્ડિયામાં પણ એ નહીં હોય. પણ વેરી ગુડ ઇન્ફોર્મેશન, એક્સેલન્ટ, થેન્ક યુ વેરી મચ. અને આપણા ઘણા મિત્રો જાણીતા પણ જોઈન થયા છે. નાગજીભાઈ, તારા પપ્પા છે ત્યાંથી, બાટવાથી, મનસુખભાઈ કોટડિયા, બધા થેન્ક યુ વેરી મચ ફોર જોઈનિંગ. પહેલા બોમ્બે જવું પડતું હતું, હવે આપણે રાજકોટમાં થઈ જાય છે. અને વેરી ગુડ ફેસિલિટીઝ, અને આપણા જાણીતા અને ઘરના ડોક્ટર. એટલે ગમે તે કોઈને પણ જરૂર હોય તો આપણે પ્રેમથી ત્યાં જઈ શકીએ. અને we don't have any problem also. બોમ્બેમાં તો ઘણા પ્રોબ્લેમો થતા. આઈ એમ ટોકિંગ અબાઉટ 1979. ત્યારે મેલ ઇન્ફર્ટિલિટી માટે ત્યાં જવું પડતું ખાસ, કારણ કે ત્યાં થોડું એડવાન્સ હતું આપણા કરતા. ઓકે, તો દ્રષ્ટિ, ગો અહેડ, ક્વેશ્ચન આન્સર્સ. થેન્ક યુ.
Yes, anyone who would like to ask a question, you can raise your hand or type in the chat box. અને raise hand માં અત્યારે મધુફઈ નો hand raise છે. ફઈ, તમારે question હતો?
એ ભૂલમાં થઈ ગયો લાગે, પહેલાથી છે.
Oh, okay. Okay, no. I think ફઈનો ભૂલમાં raise hand થયો છે. Okay.
Yeah.
Yes, you have a question? Oh no, that was a mistake as well. Okay.
લેક્ચર એટલું સરસ લીધું ને બધું સમજાવી દીધું એટલે
I
કોઈ
think બધા question and answers આવી ગયા છે already.
Thank you.
10 વાગી ગયા. કલ્પનાબેન ને પછી કેજે ક્વેશ્ચન છે કોઈને પૂછી લે.
Yeah, questions mostly everyone is thankful for the information. I think it was okay. I have one question here. How much gut issues like IBS, SIBO, SIBO can affect fertility in females?
Gut problems, IBS, these are all, psychological problems. But sometimes even allopathy doctors are trying to find the reasons, but it is all connected with your thought pattern. So, you have to change your thought pattern. Nowadays, just with this question, I would like to tell that we have been doing a research for holistic IVF. We are doing an approach in diet, meditation, healing, and other therapies also. We have meditation specialists with us. They are going to do the basic preventive to curative therapy in form of psychological aspects. So we have just like અભિયાનમાં અમારો હમણાં લેખ આવ્યો છે કારણ કે અમારો એક કેસ હતો આફ્રિકાથી. The couple has traveled, they were having poor endometrium and they were advised for surrogacy, and the female was so much of positive nature કે ભાઈ મારે તો મારા womb-માં જ જોઈએ છીએ. So they heard about us. અમે એનું PRP કરીને એક recent therapy થાય છે, platelet rich plasma for developing the uterine cavity. So we tried it for 3 months and then we went for the IVF, and in first treatment she got the result and delivered a healthy baby just before few months. So IBS and other treatments, you can go for that because IBS is hindering in allopathic aspect absorption of the nutrition in form of vitamin B12 or iron and anemia. This must be taken care. But otherwise, if IBS, you can plan for the baby once your gastroenterologist advises you, means you are fit for the pregnancy. You can go for it, but also go for the psychological aspect with treatment. I'm not asking to stop the treatment of the gastroenterologist, but in association, you can go for psychological aspects also.
Yes, okay. Thank you, doctor. I had a question about miscarriages. એટલે કેટલા common છે અને usually બહુ થતા હોય તો શું કરવું?
Miscarriage is sometimes, common. It is almost 8 to 10% with the pregnancy, not that much common. But once one abortion is there, there are high chances you can get more abortions. So again, it is a tailor-made approach. Means you have to find where is the problem exactly. Major problems are sometimes, one abortions, there might be a problem of the female egg, there might be a blighted ovum, and at which gestation it has missed. Means at 6 weeks of pregnancy, the reasons would be for genetic or egg related. At 8 weeks, it would be a genetic reason. At 10 or 12 weeks, it would be a chromosomal problem or either antibodies problem or either nutritional aspect. And if it would be around 4 to 5 weeks of means just beta HCG has raised, there might be a genital tuberculosis. So there are multiple factors. At certain age, we can have a diagnosis with proper investigations.
Correct. Again, diagnosis and a personal intervention with miscarriages to be highlighted. અત્યારે હવે we don't have any more questions. I would like to invite, we're very lucky to have.
Darshi, before that, I would like to ask
Yes.
a question.
Yes.
ગર્ભ સંસ્કાર જે છે એમાં તમારું શું કહેવાનું છે?
હા, એટલે શું કહેવાનું in the sense કે
ગર્ભ સંસ્કાર છે એ કેવી રીતે એટલે કરવાનો હોય, એડવાઇઝેબલ છે, તમે શું એડવાઇઝ?
હા 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 એટલે ગર્ભ સંસ્કાર એટલે જેમ મેં સ્ટાર્ટ કર્યું ને કે ભાઈ તમારી પાસે એક વિઝન તો હોવું જોઈએ ને કે તમારે કેવું બેબી જોઈએ છે. એટલે ગુડ વિઝ્યુલાઇઝેશન. જેમ તમે કંઈક ફેક્ટરી બનાવો તો તમારો કંઈક પ્લાન હોય, તો તમારું બેબી બનાવો તો તમારો કંઈક તો પ્લાન હોવો જોઈએ ને કે ભાઈ આપણે આવું કંઈક બેબી જોઈએ છે. તો તમે એ 2 સુધી અચીવ કરી શકો. એટલે ગર્ભ સંસ્કારમાં છે ને બધું એડવાઇસ સાથે કરતા હોય કે ભાઈ મ્યુઝિક છે, મેડિટેશન છે, ડાયટ છે, એટલે ઘણી વાર પંચકર્મ કરાવડાવતા હોય છે. અમે નથી કરાવડાવતા, પણ પંચકર્મ ફોર ક્લિનિંગ. ઘણા શું થાય કે જીઆઈ પ્રોબ્લેમ હોય, જેમાં આઈબીએસ નું કીધું, તો એવા ઘણા ગેસિયસ હોય, તો એ બધી વસ્તુ આમાં ઇન્ક્લુડેડ હોય છે. અને પ્લસ આપણા ઘણા ગાયત્રી વાળા કરાવડાવે છે, મંત્રોચ્ચાર ને એવું બધું કરાવડાવે, કારણ કે દે આર હેવિંગ એ ઇફેક્ટ એટ ધ એનર્જી લેવલ. એટલે એ બધી વસ્તુ પણ આની સાથે એસોસિએટેડ હોય છે. એટલે ક્યાંક ને ક્યાંક વિચ ઇઝ નોટ યટ પ્રૂવન. એટલે હું હજી આ જોઈ કેવા જતો તો રહી ગયું કે હોલિસ્ટિક આઈવીએફ નો અમે સ્ટડી કરીએ છીએ, અને નેક્સ્ટ અમારી ભોપાલમાં ઇન્ફર્ટિલિટીની આખી નેશનલ લેવલની સીએમઈ છે, એમાં અમે પેપર પ્રેઝન્ટ કરવાના છીએ હોલિસ્ટિક આઈવીએફ ઉપર. અને બીકે શિવાની દીદીનું નામ સાંભળ્યું હશે બધાએ કદાચ. તો સી ઇઝ ગોઈંગ ટુ કમ એન્ડ લોન્ચ અ પ્રોગ્રામ ઓન હોલિસ્ટિક આઈવીએફ. એટલે અમે બધા આમાં ડિસ્કશનમાં હોય છે કે હવે નાવ ઓલ ઇન્ડિયા ગાયનેકોલોજીસ્ટ શું ફોલો કરવું જોઈએ ફોર હોલિસ્ટિક આઈવીએફ. એ પ્રોગ્રામ આખો લોન્ચ કરવાના છીએ ઈસાર ભોપાલમાં ફેબ્રુઆરીમાં.
So someone
વેરી ગુડ, થેન્ક યુ.
Thank you. I think a question હતો કે holistic IVF ઇન્ડિયામાં available છે કે નહીં. તો that is available and it's available in Rajkot, not just India, at the Global IVF Center. Okay, so that is it. We are very lucky to have talented Kalpana Raghu, who is the director of Joy Academy, with us today. Thank you for joining, Kalpana Ben. Can I invite
Thank
you
you,
for a vote
Jyoti.
of thanks?
Yeah, thank you. જય શ્રી કૃષ્ણ.
જય શ્રી કૃષ્ણ.
પહેલા તો હું જોય એકેડેમીનો પ્રદીપભાઈ કંસાગરાનો ખાસ આભાર માનું છું કે એટલા સરસ વેરાયટી પ્રોગ્રામ્સ તમે આપો છો સમાજને. પણ સાથે અફસોસ થાય છે કે સંખ્યા બહુ ના થાય, એટલે આમાં તો સમાજને ગેરફાયદો જ છે. કે આજે હું જોઉં છું કે યંગસ્ટર્સ કરતા દાદા દાદી નાના નાની વધારે બેઠા છે. તો એના માટે આપણે પ્રયત્ન તો કરવા જ પડશે. અને ડોક્ટર સાહેબ જે હોય એને પોતે બી પોતાના ક્લાયન્ટોને બી આપો કે તમે બધા હાજર રહો. તમે એટલું સરસ પ્રવચન આજે આપ્યું છે, એટલી સરસ ઇન્ફોર્મેશન આપ્યું છે. હું તો ડોક્ટર નથી, પણ મારો હસબન્ડ ડોક્ટર છે, સામે નથી બેઠા, પણ એ સાંભળે છે બધું. મને કે આ ડોક્ટર તો શું ઇન્ફોર્મેશન આપે છે, કે કેટલું સરસ. અને ખરેખર તમે નાની નાની વસ્તુ, અને મને તો હું પોતે રાઇટર છું, મને તો એક સરસ વાક્ય તમારું ગમ્યું કે બેબીના જન્મથી જ મધરનો જન્મ થાય છે, બાકી તો એ માત્ર સ્ત્રી જ હોય છે. કેટલું સરસ. તો મધરે, હવે તો મધર એકલી નહીં, મધર ને ફાધર બંને માટે આટલું બધું રિસર્ચ થયું છે. પણ યુ નો યંગસ્ટર્સ ને એવું છે કે બધું ગૂગલ માંથી મળી જશે. શા માટે આવું સામે બેસીને? પણ આટલું બધું સરસ નોલેજ તમે ખરેખર, ઇટ વોઝ વેરી ઇન્ફોર્મેટિવ. તમે બોડીને મર્સિડીઝ સાથે સરખાવી, પછી ફર્ટાઇલ પીરિયડ માટે તમે જે વાત કરી, બીજું બધું તો ડિટેલ કદાચ લેમનને ન ખબર પડે, પણ ઘણી બધી વસ્તુ તમે સમજાય એવી રીતે કર્યું કે બિલ્ડિંગના પ્લાનિંગ સાથે જે સરખામણી કરી કે એટલે. અને બીજું છે અત્યારે લાઈફ સ્ટ્રેસફુલ, એટલે લાઈફસ્ટાઈલ અત્યારની બહુ ખરાબ થતી જાય છે. તો એવા સમયે કેવી રીતે પ્લાનિંગ કરીને કેવી રીતે ફર્ટાઇલ થાય, એ બધું તમે બહુ જ મહત્વનું કહ્યું છે. અને ગર્ભ સંસ્કારમાં તો અમે બધા દાદા દાદી શું કહીએ કે ભાઈ રામાયણ ના જોતા, અરે મહાભારત ના જોતા, તમે ભાગવત વાંચો અને સાંભળો એમ. એટલે આવું બધું પહેલા હતું, પણ અત્યારે તો કેટલું બધું છે એમાં. એટલે ખરેખર બહુ જ સરસ તમે માહિતી આપી. અભિનંદન અને આભાર તમારો. અને જેટલા આવ્યા છે એ બધાને ફાયદો થવાનો છે, કારણ કે અમે બધા અમારા દીકરાને દીકરીને બહુને કહીશું કે ભાઈ તમે આ બધું જાણો, અને કશું ના ફાવે તો દર્શનભાઈને રાજકોટમાં મળો, પણ દર્શન કરો.
Thank you for blessings.
યા, અને દ્રષ્ટિબેને બહુ સરસ રીતે બધું મેનેજ કર્યું. અને બધાનો ખૂબ ખૂબ આભાર. થેન્ક યુ સો મચ. જય શ્રી કૃષ્ણ.
જય શ્રી કૃષ્ણ. Thank you, Kalpana Ben. મારે હવે questions આવે છે. Is that still okay to ask, Dr. Sureja?
Yes.
Yes.
Okay.
So I have a question કે આવા ગર્ભ સંસ્કાર અને વિઝ્યુલાઇઝેશન જે છે, when do you see the effect of it?
અચ્છા એટલે એકચ્યુઅલી છે ને ગર્ભ સંસ્કાર ને વિઝ્યુલાઇઝેશન ઇફેક્ટ તો આફ્ટર બર્થ ઓફ ધ બેબી તમે ડાયરેક્ટ રિઝલ્ટ જોઈ શકો. જેમ અત્યારે આપણે મહેનત કરતા હોય ત્યારે આપણે ઇફેક્ટ ક્યારે જોઈએ? જ્યારે માર્કશીટ હાથમાં આવે ત્યારે.
Yes.
દર્શનભાઈ, એવું ના થાય કે હવે તો એ આવ્યું ને કે પિંચ ઓફ આઇન્સ્ટાઈન, પિંચ ઓફ રિતિક રોશન, પિંચ ઓફ એવી એવી રીતે જોઈએ એવું તમે બેબી કરી શકો, એવું થાય ને?
એટલે ઈ છે ને, ઈ તમે જેમ કહો છો ને મેડમ, એવી રીતના એને ડિઝાઇનર બેબીઝ નો કન્સેપ્ટ કહે છે. એટલે ઈ લોકો પીજીટી માં એમાં કરે છે, પણ ઈ આપણે તો વિઝ્યુલાઇઝેશન છે એ અલગ આસ્પેક્ટ છે, અને ઓલા લેબમાં કરે છે એ અલગ આસ્પેક્ટ છે, કારણ કે માઇટોકોન્ડ્રિયલ ડીએનએ ની બધું. પણ એ એના ઉપર હજી રેસ્ટ્રિક્શન્સ બધા રાખે જ છે, કારણ કે નહીતર તો શું થાય કે બધા ક્લોન જ થઈ જાય પછી એવી રીતના. એટલે
બધા એવા જ થઈ જાય. Yeah.
That's true.
અને વિઝ્યુલાઇઝેશન તો બધામાં જ કામમાં આવે જ છે, રાઈટ? એટલે
Yes,
એ
yes.
વસ્તુ તો છે જ કે તમે જે વિઝ્યુલાઇઝ કરો બેબીનું અને સ્પિરિચ્યુઅલ થાવ તો એટલું બેબી સારું જ આવે, રાઈટ?
Yes.
બકુલભાઈ આવ્યા છે, દ્રષ્ટિ આપણે.
હા, બકુલભાઈ join
Yes,
કર્યું છે.
I
Thank
think,
you for joining.
મારો પેલો કોર્સ ચાલતો હતો, અત્યારે સેશન 3 આજે પૂરું થયું, તરત જ હું અહીંયા સ્વિચ થયો, પણ લુક્સ લાઈક આઈ મિસ્ડ મોસ્ટ પાર્ટ. પણ મેં મારા એક યોગા એટેન્ડીનો એક મેસેજ મેં હમણાં જોયો. એમણે એટેન્ડ કર્યો હશે, કદાચ આમાં હજુ હશે હજુ. એમનો ક્વેશ્ચન એ હતો કે કોઈ યંગ કપલ છે એ લોકોને, પણ કે આ જ વસ્તુ બહુ સારી હતી, પણ કે ઇંગ્લિશમાં ના થાય એમ, એટલે એમને કારણ કે ગુજરાતીમાં સમજ નથી પડતી.
So
એટલે
most information was in English. Bakulbhai.
oh really? Okay.
Ha. Most information was in
That
English.
was question. I think it was
Yes.
very informative in English, sufficient enough for the young couple to understand.
Yes.
યસ દક્ષાબેન,
Oh.
તો એમાં મોટા ભાગે ઇંગ્લિશ જ હતું એવું કે છે, તો
Right. It was good.
We requested English especially because this information is mostly for general younger community.
Right.
So we thought we will keep it English for everyone.
Yeah, no, it was very good. Like I said, mostly was English, and I'm sure they understood the topic.
Yes.
ગ્રેટ
Thank you so
ગ્રેટ
much.
ગ્રેટ.
મેડિકલ
કદાચ તમે બિગિનિંગમાં જ મને મેસેજ કર્યો હશે, ખબર નહીં.
Yes, I did. Yes, yes.
Okay, okay.
ક્લાસ લેતા હોય ને એવું હતું, સમજે?
Yeah,
Awesome. Looks
absolutely.
like-
It was
યા લુક્સ લાઈક આ વાતો પરથી એવું લાગે છે કે બહુ જ સરસ સેશન રહ્યું, અને રેકોર્ડિંગ લાઈવ નથી, પણ
it
કદાચ
is recorded.
હા, પણ એમ કે આપણે યુટ્યુબમાં નથી, એટલે હવે અપલોડ કરશો ત્યારે મળશે એમ.